I'm a primary care physician. As you know, today is a World Brain Health Day, and we celebrate this thing on July 22nd every year. It has a long history. This started in 2014, and every year there is a different theme based on year by year. This year's theme is brain health for everyone at every age. What it means is why we have to celebrate these days. These days get the discussion going, they start the process of communication going. We don't realize day to day that brain health is very, very important, and that is the only thing which makes us human. Without our properly functioning brain, I don't think it's being human. And brain health is the number one reason for disability, second most common reason for death, and worldwide and in United States, we lose billions and billions of dollars or equivalent currency to brain health reasons. Main reasons like degenerative diseases like Alzheimer's, stroke, multiple sclerosis, Parkinson's disease, epilepsy, peripheral neuropathies, they make the biggest bunch of this group of diseases. As we know, stroke and dementia, they are the most feared one because they create the most important reactions which we have to work on that because once you have stroke your life is upside down and all the brain health basically boils down to our daily habits, our daily vices, and also the kind of food we eat. Do we exercise? Do we sleep good? We will unpack all of that and we will show how these things matter. But the message which I was wanted to convey is that brain health is very, very important, and that's what makes us human. And it causes a lot of pain and suffering and loss of revenue and lot of personal pain. The function of World Health Day is to start the discussion, start the awareness. Once you are aware of something, you will do something about it. If we don't talk about it, we will not know what is going on about that. And World Health or Brain Health Foundation has five pillars on which they base. Why brain health is important for everyone. I truly believe the brain health starts even before our conception. Like, if we want to bring some life into this world as a parent and responsible person, we must start taking care of ourselves first so that whenever the child is conceived, that child has the best opportunity to mentally grow, cognitively flourish. If, as a parent, we are irresponsible, we have bad habits and vices, we will produce or we will bring a child which will not be. Then we need to have a proper gynecological and obstetric care during pregnancies. Our pediatric physicians do a great job in identifying and maintaining that. But the problem starts when we become young adults and guiding our young adults to have good habits. Because any chronic disease you look, there is a theme in chronic diseases. And neurologically, All the problems are chronic, degenerative, and few of them have some genetic component. As we all know, genetics loads the gun and the environment triggers it. So we must be very, very careful. We must be very cognitive of taking care of our vices. What are the common habits which lead to chronic medical problem? The first we start is our nutrition. As a physician, there is not a day I've been asked this question 10 times a day. What are the best supplements to take? After detailed search for myself, for my family, for my patient, there is only one supplement which you need is to eat clean. If you eat Mediterranean style predominantly, which is no magic there. There is no, it's not a diet, it's a way of eating, which is primarily include complex carbohydrates, fruits and vegetables, lean meat, and very little simple sugar and fat. And whatever fat is coming, it is mono or polyunsaturated. That's what this Mediterranean style of eating is. And it is not a something which we need to, I think diet is a wrong connotation. We should not use as a dietary connotation. We should use it as a lifestyle. Second is exercise. 40% of all neurodegenerative diseases could be prevented with exercise 30 minutes. There is not a medication as a medical community which we could offer you, which is more effective than simple exercise. And you don't need to be in going to the health clubs and gyms. It's basically 30 minutes moderate intensity exercise 5 times a week, preferably seven, at a speed that you are a little bit struggle. And if you combine it with the weight training or the resistance training, balance and postural changes, you will improve your chances of getting neurodegenerative significantly. Third, sleep. United States does not sleep. We are very productive, but this productivity is coming at leading to multiple degenerative diseases, and we need to have minimum of 7 hours sleep. There are not very good, there are not too many tricks to sleep better. Limit your screen time at least 45 to 1 hour before you plan to go to bed. Decrease the temperature, have a clean, calm, dark room, and you will sleep. You may have difficulty going to the bed at a proper time initially, but if you are persistent continue to do that, you will develop good sleep hygiene. Management of stress. Stress leads to production of cortisol that messes up your circadian rhythm, and that leads to worsening of your cognitive health. Management of your mental health, which include managing your emotions, anxieties, fears. That is very, very important. If you don't do that, you will be perpetually sick. And last but not the least is the social connection. Now we don't have deep social relationship. We are connected with thousands and thousands of people, but through social media, virtual this thing. There was a study they found it out is even on the social media, if you have a deep connection or virtual connection with few people, which are deep, intimate, you could discuss, you could talk, you could get your head out, they were equally effective. And I think that was very helpful to know that so far, whatever the studies which were coming, they were all stressing on personal connection. But now the even the virtual deeper connection and meaningful connections, they are very helpful. So these are the daily habits which you will need to accomplish. If you do these daily habits, that will prevent Last but not the least, two other social habits which I would want to mention before I go to next start is smoking and alcohol. And few of people who are using drugs. This is definitely killing your brain. You must stop smoking. You must manage your drinking properly, and nobody should be using any drugs. These habits lead to chronic diseases, diabetes, hypertension, hyperlipidemia, or high cholesterol, which leads to chronic complications, heart disease, kidney disease, liver disease, stroke, and then leading to dementia, and other neurodegenerative diseases. So the key component is develop good habits and prevent chronic diseases and ultimately end organ damage and complications. Whether you take heart health, brain health, mental health, you will find the same theme of daily habits coming to you over and over. Top neurological disorders, which are as a society becoming crisis, is stroke, because same risk factors which give you heart attack, that's the same thing give you brain stroke or brain attack. Heart attack and brain attack, they clinically they are the same. Those hardening up of the arteries, if they are happening in your heart, you develop heart attack. If it happening in your legs, you call pad. If it happening in your kidneys, you will lose your kidneys and you will have very high blood pressure. The same way, if it happens in the arteries which are going to your brain, you will have a stroke. All the beta amyloids and all the toxins which accumulate in our system, either through our bad habits, our food chain system, all of these things lead to uh, deposition of these chronic inflammatory changes. But if you eat predominantly plant-based diet and good fats and good proteins, you can clear them out and you will not need anything. Key here is prevention. People are these days are pretty big in trying to prevent these chronic problems. And if they do that, I think that will be a major change in helping you to keep the things under control. People don't realize that how the daily habits are helping. There are a lot of myths around neurological disorders are that it's a genetic. As I said, the genes may load the gun for certain diseases, but environment is the trigger. So let's keep a good hand on the trigger and let's not pull the trigger and take care of that. Other main thing is that the brain is fixed. Brain is the most plastic organ which changes. If you change your habits, the way you stimulate your brain, the way you use your brain, that is also very useful and very helpful. They used to say that even in the studies, they were find the social interactions which we have, I just said, the virtual, now even connection which are deeper and meaningful, they are turning out to be equally effective. But if you could, the same analogy wise, if you have good relationships, they will help you. We could go with our society, new society norms, and we could work through that part. Things basically comes to is what kind of meaning we are giving and how this thing will work. What I would say in the end to celebrate the Brain Health Day is, if one message from primary care physician and through all my research is develop clean habits, which includes eating right, sleeping good, managing stress, having meaningful social interactions, and avoiding alcohol, stopping smoking, and stopping drugs. This will help you to cut down your diseases and chronic complications a lot. I hope this brief session was informational. My name is Kulmeet Kundlas, and I'm a primary care physician. Our channel is Kundlas MD. Like, share, and subscribe to our channel, and I will see you one of the next live sessions or one of our videos. Thank you very much.